So, very good afternoon to all the audience and our eminent speakers. As today's session for the devoted for the International Women's Day, I welcome each one of the eminent speaker which are available with us. It is completely dedicated for celebrating a strength, compassion, and leadership in the women in veterinary science. Women veterinarians are not only the healer of the animal but also powerful change maker in our profession. So empowerment in the woman empowered profession. Today we together recognize and celebrate the incredible journey and achievement, future potential of the women veterinarians who continue to inspire and shape the future of the animal health care. So I welcome each one of you for this wonderful session. To start with, I will just go for the introduction of each one of the eminent speaker. We have on the dais three speakers with us today, which says the professional journey has been taken their pace. We have Neha Singhai, madam, which is a veterinarian practicing at Lucknow and it is having a RO Pet Clinic as a founder and RV Pet Clinic and Surgical Center and diagnostic laboratories also being practiced. His expertise into the small animal ultrasound surgeries and diagnostic. Formerly, she has been associated with the wildlife veterinarian at Dudhwa National Park. There are social impact and so many welfares are there. She's a member of District Animal Welfare Board and Animal Lover Society. She's the author of a stock market trading strategies based on IPO performance, and she's moreover advocate for the animal welfare, spiritual wisdom, and financial literacy also. There are so many recognitions and honors are there, like Nari Shakti Award 2025, Femi Times 30 Most Inspiring Woman for 2025 and finalized into the Global Visionara Miss and Mrs. India 2016. With so many different type of hats has been wear by, and we are very happy to hear Dr. Neha. We welcome you on this. We have a second eminent speaker is Dr. Nancy. Dr. Nancy Sachin, who has BVSc AH along with the Master in Diploma in IVRI, Bareilly. Certificate training and small animal diagnostic and ultrasound from the professionally, she has a 3+ years of clinical experience, expertise into the small animal medicines and surgery, committed to evidence-based and compassionate veterinary care. There are a lot of areas of interest are there. Doctor has already been there in all small animal internal medicines, diagnostic imaging, ultrasonography, dermatology, prevention, and healthcare. Vision to contribute promoting to the health of pet awareness, advocate in preventing preventive care, responsible for the pet parenting and dedicated to improve the companion welfare. I welcome you, Dr. Nancy, for your presence will definitely inspire to the new next generation doctors. We
It's my
have
pleasure, sir.
Dr. Varsha Verma along with us, which is founder of a canine care centers Lucknow, expertise into the deep commitment for the animal welfare, actively involved into providing a compassionate and effective medical care to each of the companion animal. Her clinical approach is combined to that of scientific knowledge and empathy, ensuring best possible treatment well-being for the animals under her care. She has graduated from the ANDUA and Ayodhya and also master degree into the veterinary science. 5+ years of experience, clinical practice, expertise into the companion animal healthcare, focus on compassionate and effective treatment. Visions and inspirations are so many. She is an advocate for the woman empowerment in the veterinary profession also and encourage the young women to pursue a career into the animal healthcare. I am sure your presence will definitely a milestone for this woman empowerment webinar. Now I request to Dr. Neha to take a dais and enlighten us with your views on women empowerment. Thank you, Doctor. Dr. Neha, please unmute. Dr. Neha, can you unmute?
Hello,
Yeah, Dr. Neha, unmute just unmute it.
let me just try, sir. Dr. Neha, you will get a prompt. Yes.
Yes, sir. Am I audible to everyone?
Yeah, it's very well audible, madam. Please go ahead.
Okay. Good afternoon, everyone. And first of all, I really want to give thanks to the Farwell Stories to providing such a wonderful platform for the woman empowerment and the chance to be shared our knowledge, our journey with each other. So my journey started after completing my education, and when I started, I had very limited resources with me. I had a very small space, like the place where we parked our motorcycle, like very tiny space where I had started my first clinic after my education completed. And at the same time, I got the opportunity to work as a wildlife veterinarian. So initially, I was very hesitant to join the job because it was not my dream job, and I think it requires lots of courage and physical and mental strength to do the job in the forest. So but somehow I joined there, and I'm very very thankful to the whole team of national park that they provide me the opportunity to serve the wildlife and give me knowledge, experience and confidence to be a better veterinarian. So after my job for 7 to 8 years in wildlife, then because of that confidence only, I have started my two veterinary clinics and one laboratory, animal diagnostic laboratory. So now I am a founder of them. And besides these, my clinics and laboratory, which have all modern facility like X-ray, USG, and blood parameters testing, and all surgery we are doing here, including soft tissue, orthopedic, eye surgery. So this is all about my professional career, and I am also working for animal welfare activities. So I am a core member of Animal Lover Society, which is at my district place. So we are treating stray animals and doing whatever we can do for the stray animal. And the second one is the Animal Welfare Board. So I'm a core member of this national level NGO at my district place. So this is all about my professional career. Thank you.
Great to hear you, doctor.
Thank you so much.
Thanks for inspiring words which has been there. I request to Dr. Nancy to take a dais and enlighten us on her views regarding women empowerment. Dr. Nancy. Doctor, unmute yourself. Nancy, doctor.
Dr. Nancy, can you unmute yourself, please?
Uh, yes, sir. There was a little problem. Abhi theek hai. Am I audible, sir?
Uh, yeah, it is very well audible. Please go
Okay.
ahead.
Hello, everyone. First, I would like to thank FAR by Entod for hosting this webinar. And of course, out of all the brilliant veterinarians out there, I'm the most junior one. And I'm sure I would seek a lot of learning from our speakers. And it's great to have so diverse veterinarians, like ma'am mentioned. She's a wildlife veterinarian. That's really worthy of it's a very tough job, I'm sure. And it's great to hear this. And uh, I have completed my education from one of the best and oldest colleges in India, from Mathura, the Vasu Mathura. And I did my master's diploma in from IVRI, and it's been 3 years that I'm in practice, in small animal practice. And this Pet RX veterinary clinic is a very new venture in Lucknow, and it's been around 8 or 9 months that I've started my own clinic. And I basically deal with internal medicine and the surgeries for these small animals, dogs and cats especially. And yeah, I would say it's an honor to be able to speak, because I do have a little bit of experience in clinical veterinary, but there's a lot to learn, and I'm sure I would gain a lot in this field. Thank you.
Great, doctor. Thank you. Thank you for your words. Now I request Dr. Varsha, please unmute yourself and just enlighten the audience.
First of all, thank you for Entod for giving me this platform to tell about myself and my work, that whatever I'm doing with my work. First of all, happy International Women's Day to the compassionate, brilliant women that are being together with us as a guardian of animal health and bridge of the science empathy. We're overcoming to lead the challenges being to research and conversation. Today we are celebrating our dedication to the voiceless and strengthen our vital roles for shaping the future of the veterinarians, especially female veterinarians. I am proud to hear as a veterinarian that I am celebrating the incredible veterinarian services and being a backbone of our professions. We often told the veterinarians that need a gentle hand with a lion heart and an eagle eye to give a realistic approach towards our pets. I am dealing with the small animals only right now. As a woman field, we are embellished with the nurturing the life while navigating the toughest and heartbreaking situations towards the animals. Uh, from clinical practices and emergency care and research, women are driving innovation in the veterinary medicines right now. We are not just treating the patients; we are safeguarding the public health also. Right now we are also giving a large amount of variation services in milk field or slaughtering field, other than the clinic field also. So as a veterinarians, there are we have to break the lots of stereotypes regarding the male vets. There are some complications have done, challenges have came towards us for breaking the stereotypes, for that pet owners do not have much uh, realistic approach towards the females. So we have to develop that realistic approach toward the pet owner, that they bring their pets toward the female veterinarians so we can easily treat their pets. That's all right now. Thank you so much.
Great, doctor, to hear all try of all three. There are some audience questions, doctor, which are always been there because, as I said, there are so many doctors are there which are associated, and there are PGs are there which are looking forward from you some of the questions which are been there. Just I will ask one by one. The first question is, doctor, what inspired you to become a veterinarian? You can give combined answer together. Everybody can answer.
Uh, to breaking the stereotypes right now, I have to say.
Okay. What is your view, Dr. Nancy, Dr. Neha?
So I have a short story to tell regarding this. When I was preparing for my entrance exams, actually, since a kid, I can't remember anything being rather than being a doctor. I always wanted to be a doctor. My parents always wanted to see me as a doctor. So definitely, being a veterinary doctor was not in the list that time. I was preparing for my entrance exams, and I had this. There was a stray female mother dog. She along with her 4 5 puppies later, she always used to roam around near our coaching areas while I was preparing for NEET, of course. So I used to feed her, जो भी कुछ खा रहे हैं हम लोग साथ में स्नैकिंग कर रहे हैं बीच में, समोसा खाया, आलू दे दिया, थोड़ा सा बिस्किट खाया, पार्ले जी ऐसे दे देते थे। तो एक दिमाग में पैसिवली हमेशा रहता था। तो काफी महीनों तक, मतलब काफी दिनों तक, मुझे लगता है 1 2 महीना ऐसा रहता था। तो आई रिमेम्बर एक दो बार ऐसा हुआ, आई आई डिडंट फाइंड हर। तो वाज लाइक कि ठीक है, अपना खाना ना देखने कहीं गई होगी। तो 2 3 दिन 4 दिन ऐसा हुआ। कभी कभी उसके पपीज नहीं होते थे सारे एक साथ, कभी वो नहीं हुई। तो जब लगभग एक हफ्ते तक ऐसे हुआ, तो मैंने ऐसे आई जस्ट डेवलप्ड अ क्यूरियोसिटी, और जो आसपास शॉप्स वाले हैं, देयर वर चाय वालाज एंड समोसे वालाज अराउंड। तो आई जस्ट ट्राई टू इंक्वायर अबाउट हर, आई वाज अ बिट क्यूरियस। तो मुझे पता चला कि एक हफ्ते 10 दिन पहले ही शी मेट विद एन एक्सीडेंट एंड शी डाइड देयर नो ऑन द रोड। So that day, I felt a certain kind of, pain. I was not, मैं बहुत ज्यादा ये नहीं कहूंगी कि I was very attached to her, but there was definitely a bond, and I feel we as women, we are more sensitive, ये मुझे लगता है वर्ल्ड वाइड किसी भी प्रोफेशन, किसी भी स्पेस में women are more sensitive in these cases. So, and since I was a very young girl that time, so that something that affected me. I realized कि I used to think कि अभी उसके puppies का क्या हुआ होगा, कहाँ गए होंगे, ये सब इधर उधर बिखर गए होंगे, कोई बचा होगा, नहीं बचा होगा. They don't have their mother's protection. So that day, I can still feel that thing, right now also after these many years talking about that stray. तो मुझे लगा आई फेल्ट हेल्पलेस दैट डे. नो आई फेल्ट कि कुछ है ही नहीं क्या, मतलब ऐसे ये एनिमल्स सड़क वाले क्या होता होगा इनका, इनके बच्चों का, इनके फैमिलीज का. तो दैट डे आई फेल्ट कि हाँ ये करना है, ये अच्छा है. मतलब सर्विंग पीपल इज डेफिनेटली praiseworthy, definitely, but serving animals, serving those who cannot speak, that was, I think, more it is for me veterinary is more for me it is more like I'm more inclined to the sensitive aspect of it, because I have seen owners, pet owners, being so attached to their dog and cat, koi bhi pet hoga. I have seen strays who have nobody. I have seen many NGO active volunteers who come to me, and I think being a veterinarian is a very big role to play in the society. Or secondly, मुझे as a female veterinarian, maybe it's just sheer luck. I feel कि women, people prefer women veterinarians, people, because they know that they are good listeners, of course. They are more sensitive towards their pain, their suffering. So I feel in my practice, in my small, this little span of practice, I feel that people like women vets, that is what my experience is.
Great, Dr. Nancy. Thank you for sharing. Yes, Dr. Neha, what really inspired you? Please unmute. Please unmute yourself. Doctor, can you just hit the audio icon which is there on the screen, Dr. Neha, so that it will get unmute.
Yes.
Yeah, please.
Actually, sir, we can't unmute ourselves with our device. That's why.
You can, doctor. There is no restriction. You can unmute yourself.
Yeah. Okay. Thank you, sir. Actually, sir, I was preparing for MBBS actually, and veterinary science. It was my second choice. So, because before, I think 25 years back, there was no inspiration or encouragement for the veterinary science. What the career in veterinary science we are seeing in the present, it was not before 25 years back. So at that time, I must say that it was fortunate that I choose veterinary science as my career. Uh, because now I understand that it requires lots of hardworking, confidence, courage to do our work. So because not we are not only gynec or ophthalmologist, we are doing lots of work at a one roof. So we are working as a one-man army, and for this, when I realized this, so uh, we respect ourselves first. राइट ये एक रिस्पेक्ट अपने आप से फील होता है दैट यू आर डूइंग सच समथिंग वेरी एक्स्ट्रा ऑर्डिनरी. तो ऑल ऑफ द वेटनेरियन आई मस्ट से दैट आपको पहले अपना रिस्पेक्ट करना सीखना चाहिए. दैट एज महात्मा गांधी सेड दैट बी द चेंज यू वांट टू सी इन द वर्ल्ड. आप चाहते हो कि यू आर इक्वली रिस्पेक्टेड एज जो दूसरे डॉक्टर को रिस्पेक्ट मिलता है, तो आप पहले अपने प्रोफेशन का रिस्पेक्ट कीजिए. सो नाउ अंडरस्टैंड दिस दैट इट्स फॉर्चुनेट टू बी अ वेटनेरियन एंड I will really happy to be a proud veterinarian, and I will inspire other women and invite women as a veterinarian now in the future. Thank you.
Yes, doctor, thank you. One moment, Ami, as you said rightly. I just have one another question. I think it must have been come from the those who are new upcoming doctors are there. I think, how do you manage professional and personal responsibilities? Yes, one by one, you can answer.
Sir, actually, when you love the job you are doing, then it is easy to manage the things with professional and person. If you feel your work as a burden, if you feel like you are working for earning money, if you feel like this, then it's become very difficult to manage your work life balance. But I think a woman vet, as earlier doctor said, that they are very sensitive, they are very careful, they are very love their client. तब वो animals को इतना involve हो जाती हैं treatment में emotionally भी, and कि उनके लिए मुझे नहीं लगता कि वो as a job उसको करती हैं, right? For me it's a divine duty to me to treat my patient. तो मेरे लिए वो इट्स नॉट अ हार्ड वर्क, इट्स नॉट लाइक कि इट्स अ जॉब. सो इट्स वेरी easy to manage, and of course the supportive family is very essential for your professional growth. So it's negotiable to be a support system. Thank you.
Yes, great, doctor. Yes, Dr. Nancy, your views regarding this.
Uh, So first of all, I have I'm very fortunate. I have a very nice support system. I have a loving husband who loves to cook for me because he also runs a business besides being a civil engineer himself. लेकिन उनका काम ऐसा है that he has a own business. तो वो अपना बंद करके जल्दी मुझसे पहले ही फ्री हो जाते हैं most of the days. He gets a Sunday off, of course. फैक्ट्री बंद रहती है. I don't get a Sunday. I don't give myself a Sunday currently. तो I think वो एक बहुत बड़ा एडवांटेज है मेरे लिए because he loves to make me sit on the dining table and he loves to make food for me and even serve. तो ये तो बहुत ही एक छोटा सा एस्पेक्ट बताया मैंने. उसके अलावा मुझे लगता है कि शुरू से ही मेरे पेरेंट्स ने इतना मुझे स्ट्रांग बनाया. कभी भी मुझे डिस्क्रिमिनेशन फील नहीं हुआ बिटवीन मी एंड माय यंगर ब्रदर कि हमारी एजुकेशन में किसी तरह का कॉम्प्रोमाइज. आई हैड प्रिपेयर्ड फॉर क्वाइट अ फ्यू इयर्स फॉर डेफिनेटली दीज एंट्रेंस एग्जाम्स. तो मुझे वो टाइम, वो स्पेस, वो अपॉर्चुनिटीज हमेशा मिली. तो मुझे लगता है कि जब मैं अपने पापा के घर पे थी, बिकॉज विमेन नो वी एज विमेन, आई थिंक हमारे जो लाइफ में जो मेल्स है ना, उनका रोल बहुत बहुत मायने रखता है. क्योंकि जब हम छोटे होते हैं तो हमें अपने पापा का सपोर्ट बहुत चाहिए होता है ना, कोचिंग ड्रॉप करना, स्कूल ले जाना ना, वगैरह वगैरह. तो आई फील कि वो एक बहुत बड़ा सपोर्ट सिस्टम है मेरे पापा का भी जो रहा है मेरे ऊपर. तो और अब क्या है कि माय हस्बैंड, माय फादर इन लॉ, जो ये जो अब जो मेल मेंबर्स हैं मेरी लाइफ में प्रेजेंटली, उन्होंने मुझे इतना बैकहैंड में इतना फ्री कर रखा है. बिकॉज ही इज लाइक कि नहीं, आप घर का काम ये सब चीजें तो होती रहेंगी. जो डू व्हाट यू लव डूइंग. आई लव टू जस्ट बी अराउंड एनिमल्स, यू नो. आई जस्ट लव कि जब कोई पेशेंट मेरे हाथों से ठीक होता है, मुझे बहुत अच्छा लगता है. सो आई फील वाइल डूइंग दिस कोर्स ये चीज डेवलप हुई मेरे अंदर. शायद इनिशियली नहीं थी, बट हाँ, इनिशियली जो चीज कांस्टेंट थी वो था कि मेरे अराउंड जो मेल्स हैं, मेरा भाई है, मेरे पापा हैं, मेरे हस्बैंड हैं, इनका सपोर्ट सिस्टम इतना स्ट्रांग रहा है कि मुझे लगता है कि फैमिली रिस्पॉन्सिबिलिटीज, हाँ, कई ऐसे इंस्टेंसेस आते हैं जब यू हैव टू प्रायोरिटाइज थिंग्स, है ना. बहुत से ऐसे चीजें होंगी, there's somebody sick in your family, you know, तो you are expected to do a certain, behave a certain way, give a certain amount of time at home. Definitely वो चीज मैनेज होती है, लेकिन if talking about me personally, मुझे लगता है कि I have a very good support system, तो जिसकी वजह से मैं इतना पैशनेट हूँ एनिमल्स के लिए, अपने प्रोफेशन के लिए, और शायद यही जरूरत है हमें एज वेट्स, नो, या एज अ वुमन इन एनी फील्ड, आई फील.
Great to hear you, doctor. We have one more question which is mostly been asked, that is, what advice would you give to young women entering into the veterinary field? Yes, Dr. Neha.
Sir, would you please repeat or elaborate the question? What are you saying?
Your advice to those who wish to enter into the veterinary field.
Okay. Sir, I just want to say them, the woman, especially the woman veterinarian, that for every field, not for the veterinarian only, dream big, stay, work hard, and stay positive, stay motivated, and be confident. Whatever you want to work, whatever you want to do in your life, and stop seeking validation from others, right? Believe on your inner voice. हम क्या करते हैं, हम वैलिडेट करना चाहते हैं अपने आप को हर जगह से कि मैं सही कर रही हूँ, मैं ऐसा कर सकती हूँ. So stop seeking validation from others. You have the power. You evaluate yourself. Whatever you can do, कोई दूसरा नहीं बता सकता आपको कि आप क्या क्या कर सकते हो. So you have that power, and believe me, you can do more than you can imagine. So stay motivated and inspire. Inspiration is really very important for continuous learning. So अपने कुछ जो है ना, मैं क्या उनको बोलूँ कि कुछ ऐसे लोग जिनसे आप प्रभावित होते हो, उनको अपनी लाइफ में रखिए कि हाँ, इसमें ये क्वालिटी है, दिस इज द क्वालिटी विच आई रियली वांट टू बी विथ मी. तो वो क्वालिटी आप में आएगी. सो दिस इज, आई एम टॉकिंग अबाउट द समथिंग स्पिरिचुअल साइड ऑफ my work, because I have on a platform for the spiritual awakening also, and for the financial literacy. I also have a platform for the stock market education. So I'm doing lots of work at a time, and I am managing all the things by prioritize each other, what कब कौन सी चीज जरूरी है उस तरीके से. तो if you 10 years back कोई मुझे पूछे, डॉक्टर नेहा से पूछे कि आर यू विलिंग टू वॉक ऑन द रैम्प, तो मैं बोलूंगी कि मुझे क्या जरूरत है, आई एम वेरी मच सेटल्ड इन माय फैमिली. मैं क्लिनिक चला रही हूँ, वाइल्ड लाइफ वेटनेरियन हूँ, आई हैव वेरी हैप्पी फैमिली, बट नाउ आई एम डूइंग दिस, राइट? तो उस समय मैं आई मतलब मैं रियलाइज नहीं कर सकती थी कि आई कैन डू दिस. सो स्टे मोटिवेटेड. कहीं से भी आपको मोटिवेशन मिले, आप उसको जाइए. यू हैव पावर टू discover yourself. You can do far better than you can imagine, you can expect from yourself. So this is the message I really want to give every woman in the every field. Thank you.
Great, doctor. Yes, Dr. Nancy, your views regarding.
This was very thoughtful of ma'am to say this, that be around people whose qualities you want to incorporate in yourself. It's a very nice take-home message for me from this webinar, and uh, I am very happy that such experienced and learned people we get to listen to. एंड आई फील मेरा एडवाइस ये रहेगा कि जो यंगर जनरेशन है ऑफ वेट्स की, ग्रूम योर स्किल्स, है ना. सबसे जरूरी है कि अपने प्रोफेशनल स्किल्स बहुत ग्रूम करिए. पढ़ाई कभी मत छोड़िए, बिकॉज पढ़ाई आप जितना अपडेटेड रखेंगे, ऑफ कोर्स उतना ही आपको फायदा होगा, स्पेशली इफ यू आर इनटू अ जॉब जो दैट डिमांड्स कंटिन्यूअस ग्रूमिंग, यू नो. तो मुझे लगता है पढ़ाई सबसे पहले है हमारे लिए। कंटिन्यू स्टडी, कंटिन्यू रीडिंग, उसके अलावा अपने आप को अपडेट रखना, ये सब तो है ही जरूरी हमारे लिए। उसके अलावा लाइक मैम सेड कि बिलीव इन योरसेल्फ, बिकॉज आई फील कि मुझे भी लगता है कि 5-10 years बैक मैं नहीं सोच सकती थी कि मैं कभी खुद का सेटअप करूंगी, सोच ही नहीं सकती थी ऐसा कुछ। मुझे लगता था हाँ वेटनरी करते हैं, जॉब करते हैं, ठीक है, लेकिन you actually don't know what you are capable of, like ma'am said ki or especially in the case of women, I feel they are very much capable of doing uh, that they had never thought of. तो ये एक टफ फील्ड तो है ही, ऑफ कोर्स वेटनरी भी टफ है एज अ फॉर द वुमेन वेट्स। और इन जनरल जब आप एक सोसाइटी में निकलते हो बाहर, यू हैव टू डील विद 99% ऑफ द मेल पीपल, है ना। तो थोड़ा कई बार चैलेंजिंग होता है, सब होता है, लेकिन मुझे लगता है कॉन्फिडेंस कॉन्फिडेंस आता है नॉलेज से, लर्निंग से। अगर आप में कॉन्फिडेंस है, आपको अपना सामने पाथ क्लियर दिखेगा। अभी नहीं, कोई 2 साल में करता है, कोई 20 साल लगा देता है, लेकिन पाथ क्लियर होना, क्लैरिटी आपको तभी मिलती है जब आप अपग्रेडेड होंगे, आप वेल ग्रूम्ड होंगे, आप कॉन्फिडेंट होंगे। तो मुझे लगता है कि जो यंगर और जो वेट्स हैं, मुझे लगता है ऑफ कोर्स वो मास्टर्स कर रहे हैं, दे आर ग्रूमिंग देयर स्किल्स एजुकेशन वाइज। तो मुझे लगता है इसी से कॉन्फिडेंस डेवलप करें, बिकॉज वेटनरी अब बहुत एडवांस है, अब बहुत एक्सेप्टिंग है। लाइक मैम सेट कि इतने साल पहले लोग अवेयर नहीं थे, लोग लुक डाउन अपॉन करते थे इस प्रोफेशन को, ऑफ कोर्स वी ऑल नो दैट। लेकिन अब की स्टेज मुझे लगता है बहुत वेलकमिंग है, बहुत ग्रोइंग है आगे। तो मुझे लगता है कि प्रिपेयर रहो, जस्ट प्रिपेयर योरसेल्फ। तो वो कॉन्फिडेंस आएगा आप में, वो एबिलिटी आएगी टू डू व्हाट यू हैड नॉट एवर थॉट ऑफ, आई फील।
Wonderful, wonderful, doctor. Thank you for your views and words, which is there. It has been always said that नारी सिर्फ कोमलता नहीं, साहस की पहचान है। नारी का होता सम्मान वही समाज जहां महान है। Thank you, doctors, for your inspiring words for this. On a closer note, from the Fur by Entod, I thank you for all our respected speakers, Dr. Neha, Dr. Nancy, for your presence and participation, for making this webinar truly inspiring. Today's discussion was reminding all of the women, when the woman is empowered, the entire professional grows stronger. And let us continue to support, encourage, uplift the women in the veterinary medicine, inspiring and mentoring the next generation as we move forward together to build a stronger and more compassionate future for our profession. Thank you, Doctor, once again for your presence, and celebrating this empowered woman will continue to shape the future of the veterinary science. Thank you, Doctor. Thank you very much.
Thank you so much, sir.
Thank you for having us, sir. Thank you.